You're listening to Fuel Radio, inspiration and training to fuel your day. Now here's your host, Rod Jans.
Hi, everybody. Welcome to Fuel Radio. Today we're going to do a business profile, and on the line with me is Dr. Parhar. I'm going to call him Mark, if that's okay.
Sounds great.
Thanks for joining me, Mark.
Oh, my pleasure. I'm happy to be here and a pleasure to do this with you.
There was an article done on you in 2017 about root canals. So I have to laugh every time when I think about we're doing a podcast on root canals, but it's what you do and it's a necessary part of life. I've had one and I'm sure many people do. So yeah, that's what we're gonna talk about today. But before we do that, just tell us a little bit more. Tell us about yourself. Tell us about maybe a little bit about your family and what you like to do for fun.
Sure, yeah. I guess maybe I grew up in Nanaimo, BC, so in Vancouver Island. And I moved and living in the Lower Mainland since university. I moved here to go to UBC. So I live in Port Moody, BC, where I work. I have 4 daughters, so that keeps me quite busy. A lot of my life revolves around that right now. They're very active in sports, and I was active in sports, so we do a lot of sports in our family. We love to travel. We like to do adventure trips. We go to Tofino every year for a vacation. That's our favorite place to go on vacation. We all like food. We eat a lot. We cook a lot, and we like to enjoy the Lower Mainland, all the the ocean, the parks, all the nature stuff that we have here. So I try to enjoy all those things with my family.
And I know from the conversations that we've had, you're a pretty big football fan. I don't know if we should mention your favorite team. We might lose some listeners, but
of course, yeah, the New England Patriots, my favorite team. Yeah, so yeah, that can be hit or miss with people. Often miss these days.
You can't argue with success, right? Like,
true. Yeah, I played football up to university, and so I've played football most of my life and involved in football. So yeah, it's my favorite sport by far.
Yeah. And we'll talk about it a little bit, maybe in future episodes if we talk some more, but part of what you do is you're still involved in sports from a professional point of view, from what you do for work. So let's dive into that a little bit. Let's talk about your business. What do you do?
So I'm an endodontist, and what that is people don't often know, is I'm a dentist who specializes in doing root canal treatment. So I'm endodontics is a specialty. There's orthodontics, which everyone knows, periodontics, gum surgery, and endodontics is root canal treatment. So I'm a dentist who all I do is root canal treatment and associated procedures with the goal of saving a tooth and getting a patient out of pain and resolving infection.
So what's the process? Like, you have to become, it's probably like the medical profession, right? Where you become a dentist first and then you choose a specialty? Correct.
Yeah, I went to dental school at UBC. I actually practiced for about 10 years as a dentist in an office in Vancouver, but I always wanted to specialize in endodontics, which is root canal. It was always my favorite part of dentistry. So after about 10 years, I decided I wanted to specialize. Some people specialize right after dental school. Some work for a while. There's advantages both ways. So I chose to work, and then I decided at one point I wanted to do this, so I applied to graduate school and went back to UBC for the specialty program, which is a 3-year program, and then went to finish it, became a specialist.
So the decision to become a specialist in root canals, how did that come about? How did you discover your interest in root canals?
I think it started in dental school, second year dental school. We were learning about root canals. I remember sitting there, we had a class on doing root canals, and we were practicing on plastic fake teeth, and I thought, wow, this is really intriguing. I really like this. And since that point, it was always my favorite part of dentistry. And I probably put a lot more effort into learning that the best, because it seemed to intrigue me for a bunch of different reasons. So, and then that grew as I became a dentist. That grew, and I did a lot of that in my dental practice, learned lots about it. But I really realized I didn't know enough. So that's kind of pushed me to learn things that I have and go back to graduate school and learn it even deeper. So
you actually had to go back, and I guess it makes sense. You had to go back and get some more training. And
it was a 3-year program, graduate program.
Okay, excellent, cool. And what is a root canal? Why would someone need one?
So we have our teeth in our mouth, as everyone has, and inside the teeth there's a chamber which carries a blood and nerve supply. It helps the tooth grow and develop. So you don't really need it as an adult, but it helps the tooth grow and develop, but it's there. Often what happens is the tooth, that chamber which carries blood vessels and nerve, gets infected by bacteria, which happens typically from a cavity. So a cavity gets deep and goes into the nerve and causes that, hot pain, cold pain, pain to biting. So it gets infected and inflamed. And when that happens, the pain can be quite severe, as some people have experienced. Sometimes it's mild, sometimes it turns into an abscess or a swelling with different ranges of pain. And so to keep the tooth and resolve the pain, one option is to take out the tooth. But if you want to keep the tooth, you would clean out the inside of that nerve space, remove the contents that are infected and disinfect it. And that way and then you put a filling inside, and that way you can keep the tooth. It functions normally. The nerve's gone inside and the blood supply, but yet it functions normally in your mouth still. So
in preparation for this interview, you and I, we had coffee, and it's a common joke. Like it's like having a root canal, what people say, which insinuates that there's pain involved. And you mentioned it there, when we're talking about nerves and infection and all that kind of stuff. Of course, there's going to be pain, or there's going to be pain, and people are nervous about that. So what do you do to make people feel more comfortable?
It's very true. And often people come in pain, which is, it's hard to come in pain. So my goal is to get them out of pain. And I will emphasize that. They're scared, they're nervous, it's going to hurt. And it can be uncomfortable. But our goal is to get them out of pain and back to normal. So that's always, I try to emphasize how important that is to patients. And just, my practice is built, really patient-based, and to make the patient's experience comfortable. We have a gentle, we're gentle, we're kind, we don't rush things. I explain things to patients really in detail so they understand and they're empowered of what's happening. And then just I work very gently and carefully and meticulously to do my treatment as well as possible and minimize, get rid of their pain and resolve the issues that are at hand. And then I find giving them lots of information, what's happening, what's going to happen, what to expect afterwards, giving them appropriate medication sometimes, and that helps to get rid of their pain and then help make them comfortable and reassured.
Yeah, so that's probably a good reason to go to someone who specializes in it, is that you specialize also in pain reduction and in pain management and that sort of thing. But dentists do root canals as well. And what are some of the challenges for a dentist who does root canals?
That's a great question, because dentists can do root canal. You learn it in dental school. And the challenges are that teeth are very complicated. Teeth in the back are hard to access and reach. And teeth can have, in each tooth, they can range from 1 to 6 nerve canals. So the teeth can have 5 or 6 canals in the back, and they're hard to find. Teeth can have very complicated anatomy. It's not like a straight line or like a plumbing tube. It has nooks and crannies and branches and splits. So if you don't address that properly, the tooth may stay infected. So I think that dentists don't learn that in great detail. So that's a really common thing, just understanding the tooth anatomy and treating it effectively. That's probably the biggest barrier, I would think. Second thing is, in the back molars are harder to treat, they're harder to get to. So the treatment can be challenging that way as well.
Yeah, and I bet after doing hundreds of them that you've probably seen most of the problems that you're going to that could happen and that you could see. So as we've said, people can obviously go to a dentist for a root canal, but why would someone come to a specialist like you? And don't dentists refer people to you as well?
Yeah, my main source of patients is dentists referring to me because the root canal is too complicated for them to do. Or they're not sure what the problem is. They refer it because it's above their knowledge base at that time. So that's the main thing. But people often do refer themselves. They've typically seen a specialist in the past, and they know they can tell the difference, and maybe they want it. They know it may be done better at a higher level, so they want to have that done. So seeing someone like me or one of my colleagues, the advantage is, this is all I do all day long for year after year. So I think I'm quite proficient at it. I've seen, as you mentioned, the range of things can go wrong. I'm pretty good at troubleshooting and problem solving to address a problem quickly and effectively and efficiently, and to give you the best chance of saving your tooth and helping it last as long as possible.
I'd love to hear client stories, and I ask that of everyone that I do a business profile interview with. So I wonder if you could tell us about 1 or 2 people who've really benefited or been helped by you, anonymously, of course. And I'm sure there's many, but it'd be great to hear about maybe 1 or 2 people that you've really helped.
There's quite a few, and I'm really fortunate. People are kind. They send cards in or send notes or emails, or they post a review. One that comes to mind was a lady who came in. The dentist had started the root canal for the patient, for her, to get her pain, but it wasn't successful. It wasn't working. And she came in a lot of pain. And she came in, so I tried to address the pain. I had to reclean the root canal, and often I'll put like medication in the tooth. Well, she was having some issues still. And as I did a further assessment, and I've gotten better at this over the years, she was having a lot of jaw issues and muscle problems. So I diagnosed more of a muscle problem related to, that may have caused some of the issues, but that was related, and jaw. And as I talked to her deeper and deeper, both her parents had died in the last few months. She was undergoing a great deal of stress, like a lot of stress. And I think all that contributes to, non-healing. Her muscles were tender from grinding all the time. So and it was making the teeth sore, the tooth wasn't healing properly. And she was really having a lot of pain and going through a hard time. So we managed those things differently. I got her to see a physiotherapist for massage. We made her a special guard for her mouth to help with her jaw muscles. I put her in a medication regimen. And then after 6 months, she was feeling things were pretty much back to normal. And then I finished the root canal after about 9 months. We finished the treatment. Once we were stable for sure, her jaw was better. And she came in, she was a different person because she'd gotten over the stress of her family issues that she had. Her parents died. Her job was stressful. And everything was feeling great. You could tell her demeanor was totally different. And there was no more tooth pain. And she really thanked me afterwards for taking the care and time to get her there. And it touched me because she went through a lot of stuff, and I was happy I could help in my little way and identify the problem she had and fix her tooth and help her that way. So that was a small thing, but to me that one meant a lot.
That sounds great. It sounds like you really listened to her. Like you found out that there was more going on than just what was going on with her tooth. Yeah.
Often there is. Often there's a lot more going. You have to talk to patients, listen to them, because there's underlying factors that happen. And the better I've become at that, the better clinician it's made me, I think, and I'm more empathetic as well.
Improved your bedside manner over time.
Yeah, it has. Yeah, I think it has. I try to be kind and listen to people. It's really important. And especially when people come to see a specialist like myself or one of my colleagues, they don't know me that well, so they come in. And they're really nervous because for 3 reasons. They're nervous because they know they need a root canal or they're in pain already and they think it might hurt. They don't know me or my staff, so there's not a real comfort level yet. And so they're concerned. So when they meet me, my job is to get them really comfortable as quick as possible. And a lot of it's just talking to them, listen to them, right? And then to build that kind of connection. And then once they have that connection and trust, then it makes it a lot easier usually.
Excellent, Mark. Well, I hope we can talk some more. We'll talk about some other things maybe in the future. In the meantime, though, what's the best way for people to get in touch with you if they want more information?
One way is you can call my office. That's always simple.
Okay.
Office phone number. And I don't know if you want me to give the phone number or not.
Yeah, do that. Go ahead. Yeah.
My office number is 604-492-3034. And as well, email always works great. And I have a website as well. So my website is tricityendodontics.ca. It's a little lengthy, but that's a website. And from there, there's contacts for my email. And the website has lots of information about my office and patient questions that are commonly asked and addresses those things.
Cool. So that's tricityendodontics.ca. And just give the phone number one more time. 604-492-3034. Excellent. So if people are listening to this on iTunes or SoundCloud or whatever platform you might be listening on, we'll have more information about this in the show notes. And thank you so much for joining me today, Mark.
Thanks, Rod.
You've been listening to Fuel Radio.